There are two studies recently reported about the relationship of education status and outcomes of heart disease, and they report, interestingly, opposite effects. About 3 weeks ago in the European Heart Journal, there was a report that level of education plays a role in the development of chronic heart failure. In that report, researchers studied 1,800 subjects for the effect of education on heart failure incidence. During a follow-up of 21 years, a higher level of education was associated with left ventricular hypertrophy, LV dilation, reduced ejection fraction, and diastolic dysfunction. I'm not sure what to do with that information, but I'm thinking about going back and dropping out of high school. Perhaps more importantly is a study in JACC where researchers report an inverse relationship between level of education and ST segment elevation MI outcomes. Studying more than 11,000 patients in Gusto, they showed an inverse relationship such that significantly higher short-term and one-year mortality existed beyond that accounted for by baseline clinical variables. You might shake your head about this, but there is an important clinical message here. The likely explanation for this outcome is that people with less education may not readily understand the complex issues associated with prevention and ongoing care after a myocardial infarction. Thus, patients with less education might need more careful post-MI teaching and follow-up to improve their outcomes. I'm Peter Block with a CardioSource Heart Minute.